pairs, which means there's a right and a left to each one. They are exiting the brain and brain stem, which is why they are considered cranial nerves, and they all exit the skull through various skull holes. Each cranial nerve has both a number and a name. Okay, so we're going 1 through 12, and in general, they're in order. They're numbered in order from front to back, or anterior to posterior, although to be more accurate, I think anterior towards caudal, because as you shift directionally going down, it's more towards the tail. Okay. All right, and so what I'm going to show you here is one of our models, which has all 12 cranial nerves on the brain, and then this, which is one of our empty skulls, and you can imagine the brain would sit in like that. So we're looking at it from two perspectives. Okay. In each model shows these nerves slightly differently, so just keep that in mind. And they each have a very specific function, which is what you were just testing today. All right, so starting with number 1 up here, we have the olfactory nerve. The olfactory nerve, or also called the olfactory bulbs at the very tip. When we look at our sheep's brain, they have really big ones. They have a really big sense of smell. Olfactory means sense of smell. And we can see it in our skull as this thing right here, olfactory bulbs. This is the ethmoid bone and the cribriform plate, okay? So you can see these little projections from the olfactory nerve projecting through the cribriform plate and basically coming out on top of the nasal cavity, okay? Which allows you to sense odors, okay? So chemicals in the air. So that's a sensory nerve. Olfactory is all about the sense of smell. Cranial nerve number 2, this is my pituitary, moving it out of the way. Cranial nerve number 2 is this one right here. We have a right and a left, and they cross. This is the optic nerve, and this is the optic chiasm. It's not usually broken like this. It's represented here as this yellow thing. This is the optic nerve. This would be our optic chiasm. And it exits the skull through the optic canal, where it goes to the back of the eye and brings information from the retina. So it's visual. It's a sensory nerve bringing visual information in from the eye. All right, so we've got 1 and 2. They're both sensory. Moving down to number 3, which is much more subtle compared to those two. But here's cranial nerve number 3, oculomotor. So think optic followed by oculomotor. And oculomotor, if you remember the name, tells you exactly what does. It is a motor nerve that controls most of the extrinsic muscles, and by extrinsic I mean the outer muscles that move the eye around. So it moves the eyeball. When you're tracing your H today, that's a big part of testing the oculomotor nerve. In our skull here, it's one of these 3. See these 3 small guys here? I don't know exactly which one it is, but one of those is cranial nerve number 3, the oculomotor. Okay. So 3, and then here is 4, looking quite small. You have to kind of hunt for it, but it's here. Cranial nerve number 4 is the trochlear nerve, and it's also one of these 3 nerves here. It exits the skull through the superior orbital fissure. I forgot to mention that, but the oculomotor and the trochlear both go through the superior orbital fissure, so up here, again towards the eye, and serving one single muscle that moves the eye, the superior oblique muscle that moves the eye around. So just one of those muscles of the eye is controlled by the trochlear nerve.
So which test was that?
That's supposed to be the one where you look at your nose.
Okay. So.
Yeah. But I had to do a little more looking into that because optometrists and ophthalmologists actually use a slightly different test for that.
Interesting.
So because there's so many muscles there, sometimes it's hard to differentiate which one. Okay? The abducens is a little bit easier. But anyway, so that's number 4, the trochlear, and it's one of these guys. Now we come down to number 5. Cranial nerve 5 is the trigeminal. That one's really big. That's represented here. It has 3 different divisions breaking off of it. The ophthalmic division that comes up here through the superior orbital fissure towards the eye area. Then we have the maxillary division, which exits through the foramen rotundum and goes towards like the upper part of the mouth. And then the mandibular division down here, which exits through foramen ovale and goes down to the mandible. Most of your sensory information from the face is carried by the trigeminal nerve, so it's primarily sensory, but also controls some muscles.
I'm just trying to, that's where the dentist gets you, right?
Right,
I'm
yes,
looking
yes,
at
yes.
it in there. And I'm
Yes,
like,
that's where you get your shot of Novocaine. And it also controls muscles of mastication, like the masseter muscle. Okay, okay, so that's number 5. That's a big one. So coming down next to number 6. Now here's where it gets a little tricky. We're not fully going in order. We kind of skipped 7 and 8, at least on this model. But here's cranial nerve number 6. Again, it's one of these 3. So we had 4, we had 3, and we have 6. Okay? Coming through the superior orbital fissure, number 6, the abducens, again, innervates a muscle of the eye, the lateral rectus muscle, which moves the eye towards the outside. So the lateral rectus muscle, and it's controlled by the abducens nerve. So it abducts the eye. That's why it's called that. So it moves it outwards. All right, so 5, 6, and 7. Now we're coming down to cranial nerve number 7. Okay, here's cranial nerve number 7. It's this one here, passing through the internal acoustic meatus, okay, which will make sense when we get to 8. But number 7 is the facial nerve, carries motor information to most of the muscles of the face, facial expression, things like that. Okay? It also carries some taste sensory information, so it's both sensory and motor, like the trigeminal. All right, so our next nerve, this one here, on here, it's this one, cranial nerve number 8, vestibulocochlear. Has a really long name. That refers to the vestibular system, which is your like equilibrium, what you were testing when you were standing up against the wall and trying not to sway. And also it innervates your cochlea, which is your main organ of auditory sense. Okay, so that makes sense that it's moving through the internal auditory meatus, auditory vestibulocochlear. Okay, so that's what it's mainly a sensory nerve. It carries some tiny amount of motor, but it's primarily sensory. Okay, so we had number 8, and then we're going to move down to 9, 10, and 11, which all pass through the jugular canal. Over here, we've got 9. Now we're on down, sort of right underneath of our cerebellum on our brainstem. Number 9 is the glossopharyngeal. Glossopharyngeal nerve exits through the jugular canal. This one carries a lot of information to and from the throat. Remember, this was one that had to do with the gag reflex, also a small amount of taste sensation, and it brings some sensory information as well from other places like the aorta and the carotid arteries that bring blood. So it helps homeostasis, maintaining blood pressure, and things like that. So you'll learn about next semester. So that's glossopharyngeal, number 9. Number 10 is the vagus nerve. That is arguably the most important cranial nerve, and it looks so small and humble. But the vagus nerve, which exits through the jugular canal, is the only cranial nerve that extends like well beyond even the thoracic area and goes well down into the abdomen, where it innervates like your entire digestive system along with your lungs and your heart and your kidney, all over the place. It is the major parasympathetic nerve of your body. So we'll see that one, we'll talk about that one a lot when we talk about those divisions of the nervous system later on. But that's the vagus nerve, looking all humble right here, cranial nerve number 10. Okay, and then cranial nerve number 11 through the jugular canal. That's a really weird one because 11 is the one that kind of goes up the spinal cord. And it kind of comes up the spinal cord and comes with the spinal cord through the foramen magnum and then goes back down through the jugular canal, where it innervates skeletal muscles like the trapezius and the sternocleidomastoid. So it's a motor muscle that moves your shoulders around, things like that. Sorry, motor nerve that innervates those muscles. And last but not least, the hypoglossal. So we've gone down this way, now we're coming back medial. So the hypoglossal nerve, which is cranial nerve number 12. Here it is, and here passing through the hypoglossal canal, which is really hard to see, but it is its own little space that's right next to the foramen magnum, okay, the hypoglossal canal. And this nerve innervates mainly the muscles in and around the tongue. So it has that important job of moving your tongue around for eating and talking and all of that stuff. Tongue is mainly muscle. And that's the nerve that innervates it. But it's not involved in sensory stuff, so it doesn't have any taste. It's just motor sensations for the tongue. All right, that's our tour of the cranial nerves. Any questions about those? All right.
Does
cool.
Yes.
Go ahead.
Did you videotape that whole thing?
I did. I got tired and
You
really
do too.
That's
You're gonna
that's
post it?
fine, because